Here is a compilation of videos related to exercise and heart. Dr. Paul Dudley White, the famous physician who has taught many a luminary in the field of cardiology, once wrote that heart disease before 80 is our fault and not God's will or nature's will. This means that he recognized long back the role of lifestyle modification in preventing heart disease. Exercise in a regular pattern is one of the important lifestyle modifications which everyone can adopt to prevent or delay heart disease. Exercise helps in various ways. Regular exercise conditions the body so that the effort tolerance, lung and muscle function improve. So does our feeling of well-being. Of course, exercise burns out extra calories and reduces body weight, which in turn is due to a decrease in the fat deposits. A decrease in fat deposits can reverse the process of block formation in our blood vessels. Regular exercise can bring down the blood pressure in the long run. Though blood pressure rises progressively with increasing exercise, it reduces the resting blood pressure in the long run. Lower blood pressures mean lower workload for the heart, and the chance of thickening of the heart muscle and heart failure are reduced. High density lipoprotein or HDL cholesterol in the blood increases with regular exercise. HDL is the good cholesterol which gives us protection from heart disease. Low density lipoprotein LDL cholesterol, which is otherwise known as bad cholesterol, decreases with exercise, again providing protection from heart disease.
Hello friends, what type of exercise is required for a healthy lifestyle? Types of exercises recommended will depend on your age group because exercises recommended for younger age group may not be ideal for the older age group. In general, 4 types of exercises are endurance, strength, balance and flexibility. Each type has different benefits, and doing one type can improve your ability to do others and reduce the boredom of doing only one type of exercise. Endurance exercises, as the term implies, is for a longer period at the same level of activity. They are also known as aerobic exercises as they increase the oxygen consumption significantly and increases heart rate and breathing rate. Aerobic exercises are probably the best to improve the health of heart and blood vessels. They also improve your breathing or lung capacity. Brisk walking and jogging are the most popular aerobic activity. Swimming is also a good one if you can find a safe option. Swimming has an added advantage for those with joint problems as it takes away the effect of gravity on the joints. Other more strenuous aerobic activities are dancing, mowing, climbing stairs and playing outdoor games which involve a good bit of running or movement. Cycling is another good option. Don't forget to use a cycling helmet if you plan cycling as your option. Drink fluids to compensate for the loss with sweating. Warming up and cooling down periods of exercise help to tone up your body. Start low and build up your activity on a daily basis to reach 150 minutes a week or more. Activities during a routine work should be encouraged, especially to avoid sitting for a long period. More on types of exercises in the next video soon.
Strength training will improve muscle strength. Weight training is the well-known example of strength exercise. While using weights for strength training, as with other forms of exercise, start with light weights which you can easily handle and gradually progress to higher weights. Using resistance bands is another form of strength training. Start with a light band and practice till you are comfortable before moving up. It is advisable not to hold your breath while doing strength exercise. Breathe regularly, breathe out when you push and breathe in when you relax. Exercises for all major muscle groups should be planned in a systematic manner. It is a good plan to rotate the muscle groups being strength trained rather than using the same muscle groups consecutively. For older individuals, even routine household activities like carrying groceries can be made into a form of strength training. Push-ups, sit-ups and squats are simple ways of using your body weight for strength training. Caution is needed in older individuals as with other forms of exercise. Better to have a medical opinion prior to initiation in older persons. A regular exercise program is highly essential for general as well as cardiovascular fitness. It is useful for any individual who is capable of exercise. For a person with heart disease, the exercise program has to be planned in consultation with the treating doctor. Ideally, if you are planning to start a strenuous exercise program after the age of 40 years, it will be better to exclude cardiac illness by medical evaluation and a treadmill stress electrocardiogram. Even though blood pressure and heart rate increase during exercise, a regular exercise program brings down the blood pressure, blood sugar, and cholesterol levels if they are mildly elevated. Severe elevations require additional medical treatment. Regular exercise brings down the body weight and reduces the risk of heart disease. Basically, there are two types of treadmills for home exercise. The simplest is a mechanical one which does not require any electrical connection. The treadmill belt moves with the effort of the runner so that a motor is not needed. The speed is variable depending on the effort put in by the runner. It does not have many controls and is much cheaper than a motorized treadmill. Naturally, the effort needed to run a purely mechanical one is more for any given speed. One potential disadvantage is the higher strain to the lower limb joints. The motorized treadmill is very convenient if you can afford one. Various sophisticated controls are available depending on the cost you are ready to pay. The speed can be varied continuously and so can the gradient or slope. Sensors for checking the pulse rate are available. The exercise time, speed, distance run and calories spent are all displayed in front of you. A word of caution about the calories displayed. The calories spent will depend on your weight, being higher for a heavier person. But most machines do not check your weight and only the calories spent for an average person at that particular speed and incline are displayed as a function of the time run. Taking away the boredom of treadmill exercise. If you walk or run outdoors for your daily exercise, each day you can take a separate route and can watch the activities around and enjoy the fresh breeze. You lose out on all these in a home treadmill exercise. After the initial enthusiasm wears off, treadmill exercise can turn out to be a real bore. So how to get away with it? Some finish their morning newspaper reading during the treadmill time. But this is not easy unless you provide a good stand for reading the paper and have some mechanism of turning the pages. Reading small print would not be an ideal thing to do while moving on a treadmill in view of the eye strain it is likely to produce. A much simpler way is to watch music or an interesting program on television. Some use just a smartphone to listen to music. For cardiovascular fitness, at least 30 to 40 minutes of exercise for 5 days a week are required. Average calories spent per week should not be less than 1000 kilocalories. For a beginner, start low and gradually increase timing and speed over a few weeks till you reach the maintenance phase. This will help to tune up your body. Every day, the program should consist of an initial warming up and a final cooling down phase of slow speed. Any exercise program has to be maintained lifelong to remain effective. Hence, choose the maximum speed judiciously. Don't try to overdo it. You won't be able to maintain it. Don't forget to use a good sports shoe or else skin of your sole will be damaged soon and come out as blisters. Aquatic or underwater treadmill for exercise in the elderly and for rehabilitation after stroke and traumatic brain injury. Aquatic or underwater treadmill exercise is gaining popularity as a means of exercise training in persons with osteoarthritis who cannot exercise on a land treadmill. Water jets opposite to the direction of walking can be used to achieve high rate of perceived exertion in aquatic treadmill. Water currents in the direction of walking can also support higher speeds if needed for a morale boost in those with lower exercise capacity. The advantage of underwater treadmill is that there is no joint impact due to the body weight as occurs with land treadmill. Both motorized and non-motorized versions of aquatic treadmills are available as in case of land treadmills. The non-motorized versions are obviously cheaper because there is no need for costly underwater durable motors. Aquatic treadmills can be portable or custom made and fixed in a pool. Aquatic treadmill is very useful for senior citizens to avoid the risk of falls and musculoskeletal stress of land treadmill exercise. Regular exercise can improve lean body mass and overall physical fitness in the elderly. It is also useful for obese individuals and those with issues of mobility. Underwater treadmill is useful in those recovering from stroke as they often have poor balance or cannot support their weight. Unlike in land treadmill, aquatic treadmill can have advantages due to characteristics of water like temperature, viscosity and hydrostatic pressure. Cardiovascular changes occurring during immersions have also to be considered. There is redistribution of blood volume from the lower limbs to the thoracic cavity, but the increases in blood pressure, heart rate and rate pressure product are lower with underwater treadmill walking as compared to walking on land treadmill. Here are 10 reasons why you should exercise regularly. 1. Exercise in a regular pattern is one of the important lifestyle modifications which everyone can adopt to prevent or delay heart disease. 2. Regular exercise conditions the body so that effort tolerance improves. 3. Lung and muscle function improves with regular exercise. 4. So does our feeling of well-being. 5. Exercise burns out extra calories, reduces body weight and decreases the fat deposits in the body. 6. Decrease in fat deposits can reverse the process of block formation in our blood vessels. 7. Regular exercise can bring down the blood pressure in the long run. 8. Lower blood pressures mean lower workload for the heart and the chance of thickening of heart muscle and heart failure are reduced. 9. High density lipoprotein HDL cholesterol in the blood increases with regular exercise. HDL is the good cholesterol which gives us protection from heart disease. 10. Low density lipoprotein LDL cholesterol, which is otherwise known as bad cholesterol, decreases with exercise, again providing protection from heart disease. Athlete's heart is thickening of the heart muscle due to constant training in response to increased demand for blood circulation. Athlete's heart is not dangerous. It is a physiological adaptation of the heart to training and increased load. It is associated with a slow heart rate called athlete's bradycardia. The slower resting heart rate is a protective mechanism to prevent undue rise with exercise, as normally heart rate increases with intensity of exercise. There is an increase in the size of the chambers of the heart and increased efficacy of pumping to meet the high demand during endurance exercise. The enlargement of heart was recognized in cross-country skiers as early as the 19th century. Athlete's heart usually occurs in endurance athletes and may also occur in heavy weightlifters. Thickening of the heart muscle can be documented by ultrasound imaging of the heart known as echocardiogram. There could be alterations in the ECG as well. Importance of athlete's heart from the medical point of view is to differentiate it from genetic heart muscle disorder known as hypertrophic cardiomyopathy. That disease is also characterized by abnormal thickening of heart muscle. Hypertrophic cardiomyopathy is the commonest cause of sudden cardiac death in young athletes and differentiation from athlete's heart is very important. Simplest way to differentiate hypertrophic cardiomyopathy from athlete's heart is to stop training for a period and observe for decrease in the thickness of the heart muscle. While decrease in thickness of heart muscle occurs in athlete's heart after stopping training, there is no such decrease in hypertrophic cardiomyopathy as it is a genetically mediated heart disease. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.